All right. Hey, welcome everyone. Chirag here with Sine. We want to talk a little bit about the biggest news story that's happened this past week, which was the assassination of the United Healthcare CEO Brian Thompson. I think it's a really tragic event, but one that touches on a lot of different topics at the intersection of current events and also politics and morality and ethics and a lot of different things. So I think it'll be a really interesting topic to talk about today.
Yeah, no question. Near and dear to my heart as an employee of United Healthcare, this definitely hit me in a very personal way. I do want to disclose that what I share on the podcast here are my own views and not reflective of United's views. But, something that I'm still digesting, still processing, not necessarily from like a, company perspective, but more from a societal perspective and what it means to have a country where executives at corporations have to literally watch their back and feel threatened by the public, and that security levels need to be heightened up now across every industry, and just what a sad state of affairs an event like this reflects on um, our society and our country as a whole. And I know, just based on the conversations you and I have had on the pod and just having known you for most of my life, man, that, this is something that is very near and dear to our heart, and trying to find ways in which we can turn the temperature down, reduce the inflammatory rhetoric from both sides, and just try to get a more civilized approach to solving issues that we know are complex and kind of just straight up suck in our country. And I don't know that there is anyone that I would put higher at the list of things that suck in our country other than healthcare. And it definitely needs to change and improve. But this is just this horrific and such a sad way to perhaps drive even more conversations about how messed up healthcare is. But anyway, that's what I
Yeah,
had for my opening, man. I'm looking forward to our conversation and getting into it.
yeah, and then just an update that this happened less than a week ago, and today, which is Monday, the 9th, December 9th, they actually think they caught the person who did this. So, I mean, the question has to be asked: what drove this one person to commit this horrific act? But also, like you said, we're living in this really divisive age with really, this political rhetoric that is so charged that you have to ask, is that directly responsible for something like this? I mean, w- I mean, these things have happened in the past with, QAnon and, even the attempted assassination of Donald Trump. These things seem to be occurring more and more recently. Or at least it seems that way, right? I mean, we're looking at this from our lens of it happening right now. So maybe in the future we'll look back on it and say it wasn't that big a deal, but it does feel significant now as it's happening.
It feels a lot different than Occupy Wall Street.
Mm,
I think there's similarities in the points of view of corporate greed and capitalism gone to an extreme, that both what happened this past week and what Occupy Wall Street reflected in terms of societal frustrations with the wealthy class or the corporate class or the elites, if you will, the 1%, which we heard, from both of those, I guess, societal events loud and clear. But gosh, Occupy Wall Street was passive and relatively civil to just, a public execution. Like, I mean, a public just shooting, unarmed.
yeah.
Like, what a cowardly, horrible act for a human being to even fathom, and let alone fathom, but actually execute. Yeah, man, it is very interesting to think of what caused it. I mean, there's certainly a lot of difficult moral questions associated with the role insurance companies in general play for our healthcare system. We have a for-profit healthcare system, which is unique in the developed world, and it's led to some great things and it's led to some pretty awful things. And I think it's a really interesting debate on what is the right way for us to have a more equitable healthcare system.
Yeah. I mean, let's talk about that a little bit. So, If we look at our current system, right, and the frustration that maybe this person felt or a lot of people feel is that insurance companies in particular tend deny a lot of claims, right? And it leads to a lot of suffering and a lot of pain for a lot of people. So, you can almost understand the frustration that people would feel. I mean, obviously not, I mean, I don't think to the extent of murdering someone, but, you know, but if you look at the root causes of that, right, I think it's a pendulum swing, right? So for many years, there were a lot of abuses in the healthcare system with hospitals and doctors, profiting off of um, the system and patients, right? Excessive fees. So that was one swing of the pendulum. The other way now, where we are now, I think, is where insurance companies, because of those abuses on that side of the system, have clamped down on the payments being made, right, for the claims. So they to counteract the abuses that were being done before, they've had to clamp down to kind of balance that out a little bit. I think if you understand the root causes of that, you can have a more kind of sober perspective on what causes these things, right? But having said that, I totally understand if you have a loved one who died because of a denied healthcare claim that you're not going to give a shit about any of that, right? So, I mean, we have to understand the realities of it, of why people feel the way they do.
Yeah. Yeah, and there's gonna be a lot more frustration and anger for a cause of death caused by an insurance company versus, let's say, a health system or a healthcare provider, either misdiagnosing or, performing a procedure, and making an error. Like, there's just a lot more vilification of insurance company related or associated deaths than, like, obviously the healthcare. There's inherent risks to it, and I don't think that that will ever change, nor, like, would it ever make sense for that to change. But I think it also speaks to, so then what should the role of insurance companies be that will make it a more, not, I guess the right word would be that there is actually an appreciation that, hey, yes, having insurance is important to me, because if I didn't have this insurance, I would lose my house. And that's why I feel like when I pay for my car insurance, obviously very different, but the concept of insurance being, all right, if my get into an accident, my car gets totaled, like, well, thank God I have insurance, because now I don't have, 10, 15, 20 grand or whatever in the bank to buy a new car with. And so I have this, money that give me a sense of security. And I don't feel like people even have a sense of security with having health insurance, even when they have it, because now you've got high deductibles, you've got confusion about what is going to be covered, what's not going to be covered. Like, there's so much complexity in the way that insurance companies operate now that patients can't understand it, doctors can't understand it. In some cases, the insurance companies themselves can't even understand it because it's so complicated that you just have to find a way to simplify things for the entire system, for the entire operations of it. Because the model that we have now, and there's nobody that likes it. Nobody.
Yeah, yeah, and I think it is so complex that um, correct me if I'm wrong, but I think United implemented a AI tool to automate the processing of claims, which caused, I believe, a lot of unjustified denials of claims. I have to look into that a little bit more because I just kind of read a brief headline about that. I'm not sure about the details.
Yeah, I mean, there's automations that are used across all the different insurance companies, and that's for authorizations, and so for also when claims are submitted, and if they don't follow the right policy, they get denied, and if they don't have the right information, I mean, that's just how the system works in general. And
Yeah.
I think we have to find a better way. For me, at the heart of it, it's very simple, that you have a doctor that believes this is the best route to provide care for this patient. And I think insurance companies have a perspective to say, are you sure that's the right approach? And I think where the complexity comes in is the insurance company's perspective is financial, the healthcare provider's perspective, assuming all things being equal, are clinical, right? I mean, I'm sure there's those
Mhm.
that are financial, but in general, the majority, I would say, are clinically driven in their approach. And so you have an inherent friction to say, okay, is this going to be the best value and the best outcome for the patient? If you don't have insurance, guess what? You don't have access to life-saving therapies. You just don't, because you're
Yeah.
not going to be able to afford it. You're not going to be able to get a chemotherapy because you don't have the money in your bank account to afford chemotherapy. So what do? You get insurance, you pay for it, and you're super grateful if you end up being a patient that gets, I mean, unfortunately, you get cancer, that you can actually get access to therapy, get access to these drugs and medications and doctors that can try to help you to get better. And that part of the value that insurance companies do provide to society is all forgotten, and I think is all kind of washed away because of just how frustrating and complex the system has become.
Right.
The way to cut through it real Yeah, go ahead.
No, 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 go ahead. Finish your thought.
I was just gonna say that the way to get through it is just to get doctors, providers, and insurance companies to sit down at the table and redivide up the pie. I think
Mhm.
that's the way you really solve it. But anyway, what were you gonna
Yeah.
say?
Yeah, so we're going back. I'm gonna push back a little bit because I think people will have a different perspective on that, right? So you said
Yeah.
the insurance company's motive is clinical, but I think a lot of people would argue that, it's a private corporation that is, beholden to, I mean, like any corporation is beholden to its shareholders, right? So it's in their best interest. From a theoretical perspective, that it's in their best interest to pay out as few claims as possible and maximize profits, right? Would you agree with that?
Yes, that's the charter of all publicly traded companies. Yep.
Right. So, yeah, in an ideal world, I think the insurance company, I mean, theoretically, right? Yes, insurance companies should be spreading risk, improving the clinical situation or clinical results, I guess, for everyone, right? Because you're spreading it across a large group of people. But I think whether it's greed or whether it's just the nature of a corporation, I think people have the impression or just think that, they're going to deny as many claims as possible, or they're going to deny as much as possible as that they can get away with. And I think that that is where the frustration in the public comes from.
Yeah, I mean, look, that comes down to morality and ethics to me at the heart of it, which is what you and I, have based our entire podcast on, right? Like that's the heart of what you and I think about. And when, you know, like I've said many times before, for all publicly traded companies, for corporate America, for capitalism in general, there's only two ways that capitalism can really thrive in a society. Either it's regulations or morality. And I think those are the two levers that have to be pulled on to make sure that society has confidence in the institutions that they purchase products from. And if you don't, then you get either financially penalized or you get socially penalized, and people start looking down and frowning upon your organization. The balance of how insurance companies compete against each other is certainly part of the check and balance of just denying everything and making your product, basically worthless, because if you're just going to deny everything, then nobody's going to sign up for your insurance plan, and your employers are going to be upset, and you're not going to get employees because your employer only does United, and patients and sorry, future employees are going to not want to join your company because you have United, or I don't know, whatever insurance. I'm making it up, right? And so I think you have to be really still thoughtful about your brand reputation, and your perception in the market, because if you're not, then you're going to damage your shareholder value because people aren't going to sign up for your product. So there is definitely still some morality and ethics, I would hope, that get inherently driven into the decision making process related to your brand image and your brand reputation that are directly tied to your shareholder value.
Hmm, interesting.
So that's one way to kind of put a check on whether capitalism and morality can coexist.
Right. And it's the age old, free market versus regulation, right? Or what percentage of free market versus regulation that you kind of land on, and what's how do you optimize for where you want the free market for capitalism for we talked about this in the last podcast about progress and innovation, but at the same time to rein in some of the excesses and some of the greed that could enter um, an industry.
Yeah. Yeah, no question, and,
Yeah.
I mean, I think when we look at how folks have, reacted to the event and just how polarizing and how sad of an event that this was, that there's a certain level of the public that is almost making, the shooter a folk hero. Like, it's just disturbing to me, and I mean, sad, and it's just horrific to me to think that we're praising murderers, or we're hero worshiping murderers. Like, it just is like, it feels dystopian to me, man.
And I think we're gonna harp on this again, but I think this is one of the effects that we're seeing of long-term social media use. I think the flippant response that we're seeing to someone's death, someone with a family with children, regardless of what you think he may or may not have done, to celebrate the murder in broad daylight of someone is horrific, right? I'm comfortable saying that. I mean, I think if you're celebrating anyone's death, I think it is a horrific response to an event like that. And it reminded me of I think celebrating anyone's death, right, regardless of what they may have done. I almost don't want to make this comparison, but it just made me think of it when we caught Osama bin Laden, right? Going back, he was killed obviously in the raid that happened in Pakistan, and I think the it was the Daily Show. So I'm a big fan of Jon Stewart, but after that happened, there was almost a glee, and I just was very uncomfortable with that because at the death of any human being, I feel like is yeah, okay, he did horrific things, no doubt, he probably deserved to die, yes, but I don't think glee is the proper response to the death of anyone, and so, yeah, I know I understand he was Osama bin Laden and all of that, but it's just something that about that just made me feel very uncomfortable, and that it kind of made me think of that when the events of this past week and the response that we've been seeing online, and it just we have to ask ourselves as a society if that's how we want our society, the society that we live in, the society that our kids are growing up in, really if that's what we want them to see, because it's only going to get worse, right? If this is the baseline, our kids' generation is going to grow up thinking that that's okay, and it's only going to get worse, and it's going to progress from there.
Yeah. Yeah, I mean, it brings up a lot of very interesting, moral discussions that we could have related to the death penalty in our country. Are you for it or against it? I mean, I probably would take a little different view than you on this one, man. Like, I was very happy when Bin Laden died. Like, I know it sounds kind of sick and gross, but like, I felt like this was a person that had caused so much harm to our country, had changed the world in a very different way that I was not used to. To me, it felt like, his hands were responsible for the death of 3,000 Americans, and I felt like we were justified in killing him. It was definitely, I agree with you. I think America is probably got the highest value on human life from a societal standpoint than anywhere else in the world. I think we like have so much regulation and so much safety measures and so much protections and so much in our psychology about protecting ourselves and saving every single human's life that, like, until you leave America, you don't even realize how we're going kind of crazy in that regard of even common sense things. I'll give you one quick example, man. Like, when I went to Belize on my trip and we were climbing up some of the Mayan ruins, like, there was no plastic guardrails, there was no handrails, there was no, like, warning signs all over the place saying, "Please be careful, slippery when wet." Like, no, like, if you
Yeah.
took one step, one wrong, one way, you died.
Right.
Darwinism a little bit, right? And you just look at how kind of we've gone to the other extreme of like protecting human life so much to the point that we're now trying to correct for people who don't have common sense. Like, I feel like we've almost gone too extreme. And not to like, like I'm saddened when people die. I'm not that callous, but I also felt a sense of maybe relief was the right word, and maybe revenge is another word that when I heard the news about bin Laden, my first reaction wasn't sadness, to be honest.
Yeah. No, no, I can understand that, and I don't think I was not upset about his death, so let me be clear.
Mm,
But at the same time, I think it was the more the reaction that I found uncomfortable that I was uncomfortable with. It was the glee and
yeah,
the joyousness that people that's what made me uncomfortable. And so a counterpoint to that, so you said obviously bin Laden was responsible for the death of thousands, right? But you could argue that maybe not Brian Thompson directly, but he had a hand as the head of this company in the death of many people as well, right? So do you think you could understand the frustration or maybe some of the joy people maybe not joy, but maybe like some of the reactions online, the flippant responses of, okay, it's not that big a deal that this guy died because they feel like he has the blood of thousands on his hands as well.
yeah. I think the rhetoric that you read online, I think the escalation of villainizing insurance companies, and can I empathize with what it feels like to get a medical denial, to get a prior authorization denial? Hell yeah, I can empathize with that. I get them quite frequently, in fact. And like I said, work for the company. Like, it is frustrating. I get it. And I think I have the different perspective because I know what goes into these types of decisions. And I know they're not just willy nilly making these decisions for like corporate profit and corporate greed. It is a very calculated, well thought out, formulaic process for how they believe a drug should be covered based off of its efficacy, based off of are there alternatives that are not as expensive that you've tried first before you failed on a less expensive option. Like, I think that's the part that really frustrates me is that if you didn't have insurance at all, you're not getting access to any of these things that you're getting denied for. That's how society has to work. If you want a larger disparity in access to healthcare, then get rid of insurance companies. Then you want to start talking about morality and ethics and class warfare. Imagine if you didn't have insurance companies or a healthy insurance industry, how much more equitable healthcare access would be. It would be the haves and the have-nots. And you
Yeah.
tell me about at this day and age when the innovations are growing at such a rapid clip that you have drugs that literally can take your DNA, replicate it, eradicate diseases, and cure you of that. And you could have an entire episode on how much something like that should cost. How much should that cost? 1 million, two
Yeah.
million? Who sets the price for a medication like that?
Right.
Like, those are very interesting, nuanced, difficult discussions. And I think the net of it for me, bud, is that there just needs to be a better understanding of how all of this works. And I think insurance companies in general have not shared the societal impact that they have just fundamentally due to their existence, making care accessible to more people that wouldn't have access to it. And yes, does that come with the baggage and the frustrations of denials and authorizations and all that? Yes, it does. It's frustrating. It sucks. It has to get better. But at the same time, we do have a relatively equitable healthcare system.
Yeah, no, that's fair. I think maybe it goes back to education, right? I think people's perspective or people's perception is that there's a cabal of healthcare execs, right, in the
Oh, yeah.
background, kind of trying to make as much money as possible. But if they learn that, yeah, there is a process to it, there is thinking that goes into it, there's a lot of analysis and actuarial tables and all the stuff that goes into it, then maybe there will be a better understanding. that it's not just denial for denial's sake.
Yeah, and it goes back to like what you were saying earlier, man. It's like nobody really cares about the feel good stories. We just amplify all the bad shit that happens, and that's the bottom line. And you'll never get, a government worker that developed a piece of software that helps the Coast Guard to save lives, and that has over the course of its, 20, 30 years saved thousands upon thousands of lives. That person that created that software for the government and gave it to the Coast Guard as part of his regular day job, nobody knows who that is, right?
Mm.
That's an unsung hero that Michael Lewis decided to write about in his book, and we get to know about, but that will never ever make it onto a Fox News, CNN, MSNBC, or Joe Rogan podcast, right? Or, whatever other podcasts that are out there, right? Like they just don't. Like I don't know why we don't focus more on positive stories and draw more attention to positive stories when there's so many of them out there, but we get overshadowed by the clickbait and the rage bait to draw our attention and further amplify our own emotions to get the dopamine hit for the next click.
Yeah, man. It goes back to the algorithm, right? Everything is optimized for the algorithm, and unfortunately, that's what gets all the clicks is all the rage bait. And I mean, we've had this discussion so many times before, and you know, I almost feel a despair when we talk about it because it just seems like there's no way out of it because our society now is so like the social media is so ingrained into our society now. And not only that, I mean, even we forget social media, even if you look at anything, everything is about the algorithm, right? The New York Times, like they'll have article headlines to get more clicks. It's unfortunately, the reality of it, I mean, that these companies have to make money and, making money entails more clicks. And the only way to get more clicks is to have sometimes, you know, rage baity headlines. And that I feel like that's where we're kind of devolving as a society.
Yeah. No, I mean, it's a common theme in our discussions, and I think, they're all connected. Getting more human interactions, getting more local. I mean, these are all the themes that I think would help to de-escalate situations like we saw this past week. There's just this like almost rebellion, this rebel-esque feel of this MAGA movement, and there this feeling of being an underdog, and that there's this, like what you said, a cabal of corporate and government leaders that have shaped the world and left, I guess, a large part of the American society behind. And I think when you play the game of corporate America, you subscribe to the premise of you grow up, you study, you get good grades, you go to college, you get a job in corporate America, you work your way up, you have a good life, you retire. Like that's kind of the playbook. And I mean, growing up in an Indian household, you and I, this was ingrained in our head. Get good grades, you study math and science, English, okay, good, get better at it. But like that was our playbook. That was how we were raised. And I think that cultural phenomenon has propagated throughout the country for a subset of the population, but a large majority of Americans don't subscribe to that philosophy. And I think that there's a feeling that if you don't subscribe to the corporate philosophy, there's not another path or a trajectory for you to have a viable livelihood. How do you make money? Like, can you have a living owning a corner pizza shop? You used to be able to. Can you do it anymore? Like, you used to be able to make a good living, doing odd jobs as a handyman or opening up a, landscaping business. And now I feel like those kind of common jobs that were, call them blue collar jobs, it's a harder path. And I think that there's this like villainization of our current, I guess, like, I don't know, upper class, middle class, lower class, that's just like further flattening out the middle. And we don't have that visibility of upward mobility with a large part of our country.
Yeah. No, it's very true. And, I think justifiably there's I think it's almost a reaction. I mean, I think you probably noticed this trend too when we were in college and we were coming out of college, like in the 90s into the maybe early 2000s. There were a lot of really smart people going into finance, I'd argue not really creating much value, right? And a lot of that is what led to the 2008 financial crisis is um, a lot of these abuses of the financial system and a lot of really smart people instead of going into STEM STEM fields, tech, they were going to finance and that people were making a lot of money while creating very little value in society. I you know, I almost think this is a reaction to that in a lot of ways. I think it's also what's driven distrust in our institutions because sometimes the experts and the smart people are the ones abusing the system, and you can almost understand why people start to distrust those people.
Yeah, yeah, I mean, I think there's, like, I don't know, maybe there's bitterness, maybe there's just this, like, I don't know, I remember growing up, right, and my dad had this whole principle as well of, like, he thought there was just this cabal of old white men kind of running everything and calling the shots, right? And I, like, grew up with that kind of mindset from my dad and feeling like the country was already positioned in a way working against me. And it's a pretty lousy feeling. And so I'm trying to empathize and also understand what that feeling would be like because I guess I grew up with some of that. And as I've lived my life and had my shared experiences with my own bubble, I kinda lost that perspective and maybe the takeaway is, well, maybe I'm part of that group now that is, whatever, the elite. I don't feel it, but I don't know, I'm looking back and thinking, like, is that how I would be perceived as what I do for a living and, where I live and the neighborhood I live in, the car I drive and all that? Like, is that the judgment that gets passed on me? And if so, am I living my life based off of the principles and values that I hold near and dear? And I feel like I am. I mean, I still feel like I stick up for myself when I think that there's things that I disagree with from a moral and ethical standpoint, and if there's things that, we're doing that I don't agree with, I have no problem voicing my opinion. I mean, I feel very confident in my morality and my moral compass and which way it points. I don't really have a lot of confusion about it. But of course, there's always issues that make you think a little bit more than others. And I would say that when I think of what is a moral and ethical way to fix our healthcare system, and we start looking at some of the principles of stoicism that you and I, talk about a lot, like there's so much that needs to be fixed, and there's like the principles that we talk about in terms of like amor fati and like justice and wisdom and courage and temperance, right? And I think the one that I think of the most is moderation and balance. And that principle of temperance and moderation and balance, I feel like has got to be at the heart of whatever the new system is. And that's why I think it really is bringing the key stakeholders to the table. If there is this cabal of people that run the different parts of our healthcare system, literally get into a room and divide up the pie in a fair and equitable way. You know, resources should not be wasted and not be hoarded by a few, right? We need to ensure that there are marginal benefits and balancing the pie in a way that gives everybody an incentive to continue to work harder to grow the pie so that everyone benefits. That's the right system that we need to put into place.
Yeah, for sure. I mean, going back to your feelings about, um, is there this cabal? Are you part of it now? I think if we all start from a place that assumes, if we assume that every individual is doing the best they can, right, and we start with that assumption, I think that's where you get the moderation from, right? Because yeah, we're all human beings, right? We're all doing the best we can, um, and let's focus on the systems that are in place that need fixing, not individuals. I think we need to get away from blaming individuals. And because look, Brian Thompson, yes, he was the CEO of United Healthcare, but he's part of a company and a healthcare system that is incredibly complex. And he single-handedly is not responsible for anyone's death, right? There are a lot of factors there, and it's simplistic and reductive to say that he is responsible for someone's death whose insurance claim was denied. It's just it's too simplistic. There's a lot of factors at play. So I think if we start to focus on the systems that are broken or that could use improvement and start fixing those, then we as a society can say, okay, yeah, but maybe the systems need addressing. It makes me think of the new Department of Government Efficiency. Like in theory, yes, I agree. Yeah, we should make the government more efficient, right? I mean, who would disagree with that? But I do have a problem with some of the demonization that comes part and parcel with that, right? Yes, they're saying that we should make the government more efficient, but at the same time, they're demonizing government workers and individuals, and that is what I have a problem with.
If I could, if I could kind of summarize what you said, and quote the great Ice-T, "Don't hate the player, hate the game," right? It's kinda what I hear you
Yeah,
saying, right? Like,
exactly
that
right.
and it's true, right? Like, you can't I mean, he won. He won at the game that we've created for our society to try to win at. He made it up the ranks of corporate America. He happened to pick United, you could have picked another one. I guarantee you he didn't go into it thinking, "Yeah, I'm gonna screw over Americans," or whatever this maniac that shot him thought. No, I guarantee you his beliefs were moral and ethical in his desire to help improve healthcare in our country. I feel very confident in saying that. Now,
Yeah.
all that being said, your point of if and the other thing that you said that I mean, by the way, I agree with like 100% with what you're saying. Like, hard to argue that. Don't hate the player, hate the game, and give everybody the benefit of the doubt. If we did those two things, I think you're right. We would have a much better starting point, more empathy, and more productive conversation. But it's so funny that in a way, those things are the opposite of what the damn social media algorithms preach. The social media algorithms preach more escalation of rhetoric and more inflammatory language to drive more progression towards whatever extreme you believe in, right? It doesn't teach moderation. It doesn't teach temperance and patience and equitable solutions and balance. Like, we have to find a way to get back to that type of perspective and mindset so that we get optimal outcomes and we don't get suboptimal outcomes. And I think you and I can do another whole episode on the Department of Government Efficiency and my thoughts and feelings on that. But as far as like, is capitalism under threat? I think if the events of this past week don't say it's in big trouble, I don't know what does. I mean, I view it as such a significant inflection point in how our society, our capitalistic society operates. It's huge to me. To me, it was a very significant turning point.
Yeah, no doubt. Yeah, it's really sad. And I hope that some of the people in power can bring down the rhetoric because it's hard not to think that it's the rhetoric that has caused this, right? We said it before, but yeah, it's such a difficult situation. I don't really know how we address it, how we even begin to address it.
Yeah. I mean, I remember growing up as a kid, like, you would hear world leaders say things like, yes, we condemn this activity. And I was like, well, of course you condemn it. Why do you even have to say it? Like,
Uh,
it seems so stupid that we had world leaders like our president saying, we condemn shootings and we condemn murders and we condemn, like, and now you're like, well, crap, maybe it wasn't so stupid to say that we condemn these things because the absence of that is inflammatory rhetoric. Like, it's the things that are not said that can further impact our zeitgeist, our societal psyche. And having a leader that can calm things down as opposed to add fuel is desired. I mean, I think we need leaders that are not pouring gas on the fire. And we need temperance. We need somebody that's going to talk balance, that's going to talk compromise, that is gonna truck like healthy social discourse, that the best path is through a balanced, nuanced, in-depth discussion, not just, well, my way is gonna be better than everybody else's ways. Well, what's your way? Don't worry about my way. I'm figuring it out, but just know that I'm the only one that can fix it. Like, come on, like that's not gonna I don't think that's the way to solve our issues.
Yeah, and, I think there's lip service paid to bipartisanship, but, I think you do need a balance, and it's more than lip service. I think you need different perspectives, and we've talked about this, I think and you need more than 2 parties, and, that's a whole other conversation that we need to get into. There's a lot of ways to get there, but I don't know that we have the political will to get to that place where we could potentially have more than 2 viable parties. But yeah, I was going somewhere with that, but I kinda lost.
No, I mean, I'll go back to some of the other stuff that you raised of like, you know, not hating the player, hating the game, and working to make the game more fair and equitable. I think that's so well said, and that's a sentiment that I think we all should really get behind, and that's what we should be talking about, and that's what we should be focusing our energy on is how do we fix the game to be more equitable? And then the second point that you made to that was just give people the benefit of the doubt that what they're doing and what they're trying to do is not self-serving, but that it is trying to make things better. And if you don't think what they're doing is making things better, then have the courage to say why, have a discourse about it, have a civil discourse about it. And if you still don't get anywhere, then have a rally, then have a sit-in. Like, there are so many nonviolent ways to get what you want if your social discourse isn't working, and choose those ceremonies, choose those avenues, those channels over a cowardly, w wimpy, literally shooting somebody in the back, which inherently everyone in our country should be condemning. Despite what you believe in, we all, I would hope, would agree that it is a cowardly move to shoot somebody in the back. Only a wimp and a coward would do something like that.
Yeah, I mean, no doubt, and I think if you don't condemn it, I think we're in danger of normalizing that, right? And that is the big threat, I think, that I see coming out of this, that if there is, based on the public reaction and the reaction on social media, that we risk normalizing this kind of a behavior, and that's not good for anyone. I don't care where you are or what you believe in, you could be next, right? If someone doesn't agree with what you're doing, then you could be next, and I don't think that's the society any of us wanna live in.
Yeah. No, and it was very interesting. I posed not exactly that question to a friend of mine, and he did say it was sad, and he was like, it's horrible what happened, but he also was a little bit of like, well, he had it coming to him. And I'm trying to do the same thing that you just said, where we cannot normalize this type of behavior. We all have to speak out against shooting somebody in the back is a cowardly act. Shooting somebody that's unarmed, that has just literally doing his or her job, is what wimps and cowards do. Like, you just cannot hero worship. This should be unequivocal in my mind. In the absence, we're not there. Clearly, we've got much different perspectives. And I guess my challenge is to encourage all of us to do what you said, Chirag. It's, let's give people the benefit of the doubt, and let's try to fix the game. Let's try to fix the system that we're operating in, and do it through civil discourse and nonviolent means. That'd be my take.
Yeah, for sure, and, we have a lot of checks and balances, right? Like you said, you have a lot of ways to non-violently try to change things, and we've seen it happen. It's not unheard of, and people have changed, deeply entrenched systems through nonviolent protests and writing about it and talking about it and giving speeches about it. And so it is doable, but you have to have the courage. Like you said, this is a cowardly act, and doing the right thing requires courage. And I think We have to remember that, and I think we have to talk about it and hold people accountable to say that, yeah, this was cowardly, and I hope a lot more people will be doing that.
Yeah. Yeah, I hope so too, man. And just even the rhetoric and the language and the inflammatory stuff, like if we just start realizing we have more in common than we have different, and we have to work collaboratively to get to an optimal solution, just start talking more. Like, forget about it. Okay. Like, let's just say, like, we're all sad. Let's not have sad things happen. Let's work towards fixing the system so this type of crap doesn't ever happen again. So that's it, man. That's all I got.
Yeah, well put.
Cool. All right. That's, that's the pod, I think. You got anything
Yeah,
else?
I think that's a pod. No, I think that's good. Keep talking and, let's be more civil.
Yeah. Yep. Amen. All right. Well, until next time, keep questioning everything.
Accept this podcast. See you next time.
Later.
Later.